In this video, we will talk about endometriosis. We will also talk about its complication in ovaries. Known as the chocolate cyst, what is endometriosis? It is a condition in which endometrial tissue lies outside the uterine cavity. How is it different from adenomyosis? It is different from adenomyosis, as adenomyosis is a condition in which islands of endometrial tissue lie deep within the myometrium of uterus. Occurrence of endometriosis. It is found in approximately 5 to 10% of women of reproductive age. Location of endometriosis. Local spread. It is found in following organs: ovary, in the form of chocolate cyst; peritoneum lining the pelvis; pouch of Douglas; uterosacral ligaments; bladder deposits; bowel deposits; systemic spread; bivascular and lymphatic roots. Endometrial tissue can embolize in distant sites on body, away from peritoneal cavity. For example, umbilicus, pleural cavity, abdominal scars, nasal passage. Mechanism of endometriosis. Just like endometrium of uterus, this ectopic endometrial tissue responds to cyclical hormone changes in the body. This leads to cyclical bleeding and inflammatory changes. Eventually, it leads to fibrosis and adhesion formation. Clinical features. In female reproductive tract, it presents as dysmenorrhea, cyclical, non-colicky pelvic pain, around the time for menstruation; dyspareunia, pain with intercourse; infertility, in 30 to 40% patients. In case of gastrointestinal tract, it presents as cyclical perectal bleeding, deep pain on defecation; dyschezia. If it involves urinary tract, it presents as cyclical hematuria, dysuria, flank pain or loin pain. If lungs are involved, it presents as cyclical hemoptysis, hemopneumothorax. There can be extraordinary signs. It can present as cyclical epistaxis of nose, cyclical pain, swelling or bleeding of umbilicus, cyclical pain or bleeding from abdominal scars. Diagnosis. It is diagnosed by physical examination. Can show thickened or nodular uterosacral ligaments, tender pouch of Douglas, adnexal mass, fixed retroverted uterus. Transvaginal ultrasound can detect chocolate cysts, kissing ovaries. Rectal endometriosis. MRI detects lesions more than 5 mm in size, in deep tissues like rectovaginal septum. Laparoscopy, traditional method. Complications of endometriosis. Due to fibrosis and adhesion formation, endometriosis can cause following complications: infertility, frozen pelvis. Chocolate cyst. What is a chocolate cyst? When the endometrial tissue is implanted in the ovary, it forms an endometrioma. Due to the bleeding phenomena of endometrial tissue, this cyst has old collection of blood that is thick brown in color. That is why it is also known as the chocolate cyst. Treatment of chocolate cyst. Its symptoms can be controlled with analgesics and temporary menopause-inducing drugs, but definitive treatment involves surgery through laparoscopy. Laparoscopic removal of cyst. This involves drainage of chocolate cysts, along with excision of inner cyst lining, to prevent recurrence in the future. However, this will damage the inner lining of ovary. That affects fertility of patient. Treatment of endometriosis. It has two types of treatments: medical treatment, surgical treatment. Medical treatment. Since endometriosis is estrogen dependent, it resolves on menopause, so it can be resolved temporarily with creating artificial menopause, also known as pseudomenopause. Medical treatment has two purposes: treat the pain, create menopause temporarily. Number 1. Treat the pain. Pain is treated with NSAIDs. Opioids are contraindicated. Number 2. Create menopause temporarily. It can be done by following drugs: combined oral contraceptives. First line, progestogens. Second line, gonadotropin-releasing hormone agonists. Third line, surgical treatment. It involves two types of surgery: laparoscopic removal of deposits, hysterectomy, and oophorectomy. Number 1. Laparoscopic removal of deposits. It involves drainage and internal excision of chocolate cysts, removal of peritoneal deposits. Number 2. hysterectomy and oophorectomy, total abdominal hysterectomy, plus bilateral salpingo-oophorectomy, along with removal of all lesions, should be considered only in women who have completed their families. That's all about endometriosis. Thanks for watching. Stay tuned for more.